Welcome back to Data Nerds. I'm Mike Brown, joined by,
Pat Healy.
and Pat has an interesting case for us where he used both isokinetic dynamometry and jump testing. So take it away, Pat.
Give me the reins. Okay. So this patient is a young high schooler. She had a knee operation done back in January of last year. Well, I guess this year. Um, for a osteoma on her tibia, on the actual, I believe, on the tibial plateau. Um, in any case, she had an ablation done, and she was coming to us pre-surgery with what seemed like just patellofemoral pain, and then as the course of rehab kept on going on, just kind of those red flags that you were taught throughout school started to come up, like the weird night pain that would just like wake her up, even while like activity levels keep on decreasing significantly. Um, Not really reproductive with exercise, and just, yeah, in any case, I was not on the initial case, but my coworker then referred her out to a local children's hospital, which then found this osteoma and took care of it. And then she got evaluated by me. This is 2 weeks ago, because she started having knee pain again. And upon, thinking about it, of course, with a history of cancer, or sorry, benign, tumors, got to have that kind of in the background of your mind. Like, is this a kind of regrowth? Could this be the same thing because she has a history of it? But my first assumption is this is, she got this surgery done, she patient that came in, and then I'm sure she has some deficits in terms of maybe strength or offloading. So when she came in, we just did a quick screen. She had no pain upon like quick MMT functional screen, like squatting, hinging, step ups, lunges. Um, and so my order of process, how I went about this was, I want to clear off all like the quote unquote basics. So, like range of motion, making sure, like how I just said, MMT and functional movements are not reproducible of pain, make sure there's no neurological involvements and such. And then once those are cleared, then I wanted to get into some actual jump testing. So I know what we're looking at right now is the force trace curve from the isometric test, but I just want to mention that I did jump testing first. I think that's pretty imperative to talk about, because doing the jump tests is going to be a high central nervous system stimulus, which, in my mind, if you do the isometric testing first, that's going to be very detrimental to that jump testing, especially since a lot of people, if they do a lot of, not a lot, if they do the isometric strength testing correctly, they should probably be pretty sore. And I would not want someone to be very sore and then start doing some jump tests. I would just assume that would not give you the best results. And so I do it from a high central nervous system stimulus. So things that are quick, require you to be very explosive and fast, and then work our way down to a lot of the longer duration holds, more just true mechanical strength. And then if this was someone who I'd be worried about conditioning with, I would probably do conditioning at the end just for metabolic. So I bring up the strength testing first because I think this information is good to have before we talk about the jump testing. So what we're seeing is just the isometric knee extension and knee flexion tests utilizing the HUMAC norm by CSMI. We do this at 60 degrees of knee flexion, um, and the person gets 3 trials, each being 5 seconds long with 10 seconds rest in between. And we take the best or the peak torque. And so looking at this now, we can see that not the strongest of individuals But to be fair, this individual is younger, no real training history besides for PT. She did mention that she did have some strength training back in May, I believe, for like 1 month for twice a week for cheerleading. But outside of that, nothing else. And so, what I'm really looking for here with those expectations in mind is this symmetrical and is this painful? Both of those are yes to symmetrical, no to pain. So, although do I think this individual can be stronger holistically from a general athleticism standpoint? For sure. But in terms of my procedure of testing and what is going to be our biggest rock in the moment, this allows me to know that we're kind of checking the box on this. So, what values do I generally look for with people? I'm normally looking for about 100% body weight on knee extension and then over 60% body weight on knee flexion. Like I said, she's well away from both of those, but I'm more so using this to see is there any clear deficits side to side in terms of is she limited by pain in that right side or is she just weak? And is she weak on
Yeah,
both sides?
so
Yes.
just okay, yeah, just so I can make sure I'm looking at the same spot. It's that like top peak force or peak torque one percent body weight. She's 58 and 59% right
Correct.
left.
Yep.
Cool.
Yep.
Yep. And yeah, so that is fairly weak on both sides,
Fair.
but she's also young, right?
Correct. Yeah, she's also young, um, and not a very extensive training history outside of just sport participation. So no true like resistance training history.
Okay.
So we got done with this testing. This was last, like I said. And now we'll go over to our Vault Hub to look at our jump testing utilizing the Force X. I did 2 rounds of jump testing with her. I did the counter movement jump, excuse me, and the loaded counter movement jump. With this, for people who don't know what a counter movement jump is, it's when you stand on the force plates and you put your hands on your hips and you tell the patient client, say, I want you to go down as fast as you can and then jump as high as you can. The counter movement jump is classified as a slow stretch shortening cycle action. So anything above around 250 milliseconds for the task. And examples of fast would be like hopping or drop jump if you have the height of the drop optimized for the individual. And so, what this is looking for is more of that compliance within the joints to then use the elastic energy to then rebound and jump. Okay. Um, but in terms of rehab, okay, we are using it to see eccentric ability. When we have people who have any kind of knee impairment, what's going to be probably the most challenging thing for them to get back to sport is those very, very high eccentric loads and deep knee flexion. All right. I think classically we think of like your post ACL, you know, they get into what is a stiff knee or a shallow knee flexion, and they utilize a lot of hip strategy and forward trunk flexion. Okay. So we utilize these decks to see is this patient offloading that knee when they're going towards the actual beginning of the concentric phase. So what that looks like in our force trace here is the dipping down. Okay. So that's going to be the unweighting. And then as that curve goes up, that's that eccentric braking phase. And then all the way until it drops down to nothing is our propulsion phase. And then we have the landing, obviously, on the other side. So for reference, the blue is the left, orange is the right, and her right side is the affected one. I pulled up this one. She has 3 tests done. We did 3 on each side. And the one you're seeing now is from the loaded counter movement jump. The loaded one, I only did a 30% increase in body weight. So how she did this, she was holding 2 20-pound dumbbells on each side and completed the same task from the counter movement jump. Why I did not go up to 60 was because this was already enough to kind of extrapolate the values. So why we use a loaded counter movement jump in addition to a counter movement jump is that you can have athletes who do very well on the counter movement jump, show very uh, little asymmetry, or the asymmetry you do see kind of goes back and forth. That back and forth asymmetry is actually normal. You know, if you see some distribution between the 2 limbs, that'd be normal to see. It's when you see it all biasing one side that's raising a flag that this person is, you know, putting it off onto the other limb. So we see that with loaded counter movement jump, those people who actually do very well in the regular counter movement jump, it kind of extrapolates any of those lingering deficits and actually might show you more than what the person actually might be ready for. So that's why I pulled up this graph here, because as you can see, it really extrapolated how she's putting on a lot more through that left side throughout the whole thing. Any questions, Mike? I know I kind of just like word vomited a little bit there.
No, so just to, I guess, to summarize, to make sure that I'm with you, is you're doing both a body weight counter movement jump and a loaded counter movement jump. Normally you do a little bit heavier of a load, but you actually could already see changes with this lighter load, and you do a loaded jump because it's just increasing the demand on the body. And so if it's a harder bar to hit, essentially. Like if they hit the bar at the body weight, cool, but then you want to make sure that they can also check the boxes at the loaded jump too before like you do return to sport or anything like that.
Right. Yeah. So if we're thinking about it in terms of physics, right? When we are doing the loaded one, where I would be the most curious about that difference is the force at 0 velocity. And why that is because as the person is dropping down, although they might not be going at the same rate at which the weight would fall, you know, at that speed of gravity, they are still moving in the direction of the gravitational pull. So the moment when they have to start to begin to reverse is when you'll hopefully see that start to really expand in terms of deficit if it's present. Because now, you know, you're dropping with relatively similar to what it would be for body weight because you're unweighting, right? And then it's when you're starting to apply the brakes there. It's like, oh wow, we have more going towards the ground now,
Yeah.
relatively. And so, yeah, like I said, it just kind of expands anything that we might have missed from the body weight. And so, I think first thing to mention is you should look at strategy when someone is doing a counter movement jump. What I mean by that is if the person is doing each jump differently, can you really get anything from the values elsewhere? I would compare this to a poor setup for an isometric test. If you have a poor setup for an isometric test and that joint angle is changing with every single rep you do, are you really gaining any insight into what you're testing? I would argue no. And so, what that looks like in terms of jump testing is the counter movement depth. So, let's go ahead and scroll down. Counter movement depth. So, what I look for here is is her COV less than 10%? This is the arbitrary cutoff from all research, but we're just going to continue with that throughout our
Can
use
you
here.
explain COV for people that may not be
Coefficient of variation. It just means how far away are they, getting from their values, like what's the variance here? Like a lower COV means that they're tightening up their values. I know there's probably better terms for that scientifically, but I'm going slang. I'm going street science. But biggest takeaway from this is she is fairly consistent with her counter movement depth, except for that last one, but it's still within that CLV, even with that one added in there. So next from there, do you have any questions, Mike?
Just for people that are potentially listening, like COV is the COV for counter movement depth is 8.9%.
0.9. Thank you. Yep, I did not think about mentioning that. Okay, here is the second one that is important. So you first have your strategy. Okay. Next, you need to have the prerequisite speed. All right. Why is that? Well, think about if you slowly bring yourself down into a deep squat and then you jump out of it, is that really testing your brakes? No, because you have full control the whole way going down. You can be very conscious about how you're spreading your weight between your limbs. So, if we're really trying to assess the braking ability and checking for offloading during that braking phase, then we need to have the prerequisite speed to go along with it. There's a really good article by Daniel Bove that talks about different metrics for counter movement jump. And in that, he states that a negative or a, sorry, it's noted as negative, but a 1.20 meter per second peak velocity. Okay. That is kind of the standard metric that you're looking for to make sure this person is actually moving fast enough to actually show the braking ability is sufficient. Okay. Now, for the people who aren't watching, this person has an average of 0.82 meters per second. So they are actually not going fast enough. And their COV for this is actually 8.28%. So they're fairly consistent on this as well. So let's say someone is showing really good values elsewhere. So like all the values that you're kind of using look really good, but this is what I saw. I would still not hang my hat on those values afterwards. But since this patient is still showing deficits for the values we're going to talk about next, then I am still using it, even though she's not going as fast as I would like. Now with that,
I have a couple questions too. When you're done,
yeah. With what I was saying, I think patient comfortability with the testing is a big thing. And so this is the first time she's ever done a loaded counter movement jump. So I can assume there might be some apprehension to it, which is why she's probably not going as fast as I would have wanted. But like I said, I still got the values that I was not hoping for, of course, but we found results within this that I can build a plan around for her to try to get her back to doing her sport.
yeah, that was one of my questions. Was like the testing familiarization, right? Like my guess is then this
Yep.
happened after the body weight counter movement jump too, so that like I I know it's hard on your end right now, like because of HIPAA things to um, show like what she did for body weight, but like if you remembered, was she Was she hitting that eccentric velocity at just body weight too?
She was for a few. She was like hanging around the value for a little bit. Um, but yeah, she did. She did on I think it was like one or two of them, and we only did four. But
Gotcha.
like I said, she was hanging around there.
And were you cueing her to like load or like drop down quick too?
Yes, yeah. So I was telling her to drop as fast as she could and jump as high as she can.
Yeah.
Yeah. So,
Gotcha. Yeah, so
um,
I mean that's just good information there. It's just knowing like okay, she doesn't trust her legs to do this.
right, right. And so let me scroll up here. All right. We'll talk about landing soon. Decel. All right. So I guess we can just go from the top. All right. RSI mod, meh. Concentric impulse, not too worried about it. P1 concentric. Like for anyone who's watching, everything is biasing the left side.
Mhm.
Um, like it's always blue. The only one that doesn't have blue is the P2 concentric, which is the second half of your concentric phase. So going from like 50% of the movement until takeoff. Um, okay. Eccentric DXL impulse asymmetry. Heavily biasing the left. Okay. Like, was that an average of 12% asymmetry to the left? And yes, the COV on this is 27.5.
Huge.
But I'm still going to hang my hat on the fact that she is really putting it on that left side there.
Yeah, I think part of it, like the COV being that high, is then also a sign like, okay, she's not like she doesn't want to load this area.
Yeah. Um, EXL, eccentric DXL, RFD. Um, I don't put too much weight in this right now just because there's a lot of calculations that have to go into it, which make it not as great. But then peak landing force, again, heavily biasing that left side, just consistently landing on that left. For people
Big
who are
COV.
big COV, 50%, but she is landing an average of 30% asymmetry towards the left, with the highest being 46 and the lowest being 6%. So, um, and then eccentric DXL impulse to body mass. I'm not looking at that right now, to be honest with you, but I'm looking at that eccentric peak velocity, peak landing force, and the eccentric. Where is it here? Uh, DXL impulse. Those are the big ones that I'm looking at.
Yeah.
And
I'm
what do we
also
see? What's up?
I was curious just on something too, like just knowing there is so much variation too. Are you doing any qualitative assessment too of like I mean like recording her while she's doing this and then like looking at how does form look as she's doing this like each rep that she's doing it?
So since she's a minor, no.
Hmm, fair.
Um, yeah. Okay. Sorry. A few other metrics. The eccentric peak force. That's another big one. And then one that I failed to mention was the force at zero velocity, because especially with the loaded one, like what I talked about not too long ago, is that force at zero velocity is really going to be telling, especially underneath these loaded situations, just because they have a lot more relative load that they have to put into the opposite direction. And even with this one, the COV is at 16%, so it's a little bit tighter, still above that 10%, but still a range of 10 to 15% asymmetry towards the left. So I don't know if, for whoever is watching, a lot of blue, which means a lot of
Yeah.
the left leg.
Yeah.
So kind of where do you go? Well, I guess first, before we go on to how do you build this into a plan, do you have any questions, Mike, or any comments?
No, that was just going to be my next question is like, where do you go with this?
Right. So yeah, how do you build this into a plan, right? Because like, sure, data is fun to look at and take, but it's only as good as how you implement it. Um, Building comfortability with producing load through the right leg in these actions. Okay. So, first one being just getting into that deep tier kind of deep knee flexion. So, whether it be like oscillations in a deep tier split squat, just like kind of getting into that deep part of the range and just going up and down, especially as long as it's not painful, just building comfortability in those positions, doing really long like isometric holds, like isometric wall sits in a deep knee flexion angle, and then just working on landing. Okay, so can she do like a step off where she's accepting load through that right side in a deep knee flexion angle and going up from there? And then honestly, from that point, are we able to retest every session to see are we making change? Um, I I do not want to cue someone while doing the test or like doing it on the force curves necessarily. I think that kind of brings a bad direction of like internal cueing with this. Um, if I really believe that this is just a offloading and comfortability with loading that right side during these slow stretch shortening cycle actions, then let me train that and regularly test it to see if it's going to get better before I start applying any kind of internal cueing.
Yeah. Do you think with a consistent testing schedule that she would then be expecting to see like lots of progress every time? Like I guess I don't know what your like what frequency you're seeing her at, but like I guess you'd also want to set the expectation of like, it takes a while for these things to happen.
Yeah, I think as long as she's pain free with it, I would I would hope this to take not too long. Like I wouldn't imagine it to take more than like 10 to 12 weeks. Um, but if it is pain limited, then that's when you might see it extending out a little bit longer. Um, so yeah, I guess if we're going to talk about the case more specifically, this patient came in on a electric scooter without any parents, and then I said, well, she's doing, she's a student, so that already makes it hard from scheduling. And then she also is doing after school cheer, which makes it hard for scheduling. And then I work Saturdays, and that's like the only day she can come in, and I'm fully booked. And so as of right now, I have not seen this individual. Um, and I hope, you know, to see them again. But as of right now, I have not seen them. And at the minimum, it would probably be a once a week frequency starting our sessions with doing counter movement jump to see how are we coming along. And I think a big part of that also is the first metric I would probably look at is that eccentric peak velocity. I would want to see, does that change first? Does she want to go to the floor faster and actually produce force faster because she's dropping faster? Um, that is the one that I would want to see first before we start seeing all the other results, such as like peak at zero, peak force at zero velocity, eccentric peak force, all those, because those are all just going to be productions of the steps leading up to it.
That just made me think, are you queuing it all for depth in the counter movement jump too, or is it just like whatever she wants?
So I did not with her. Um, I just told her to drop as fast and jump as high. Um, so could that be a cueing problem? Sure. Yeah. I do think with some other patients where maybe they aren't getting as much depth, and I say, I want you to drop low as fast as you can and jump as high as you can. Um, I've I've had a tough time figuring out like a good way to, because when I tell people to do that, sorry, I just like cut off one sentence to go to the next. When I tell people to do that, they think, oh, I need to go ass to grass and then jump as high as I can. It's like, no, no, you don't need to get your bum all the way on the ground. I just need you to go further. And then it becomes like this
Yeah.
weird, then becomes this weird interplay of like, no, you're not going deep enough, but now you're going too far. And like at that point, then it's like, okay, am I trying to internally cue this too much to where I'm like, what are we getting out of this? Um, and I think that's why, because I rarely take one jump test as an absolute. Like, yes, we're talking about this one in an absolute as a one jump test, but I would want to see serial testing to see is this consistent, just because jump testing is so novel to people and because there's so many factors that play into it. So I guess, sorry, how does that relate to counter movement depth? If you cue them during future sessions to go deeper, are they able to do that consistently and build some greater depth with it and sustain it? But um yeah,
Yeah, because I'm just curious how like depth could be a mediating or moderating factor to all the other variables that we see. Um,
for sure.
and like
Oh, it is. Like
especially
by yeah. Yeah, you're totally right. Like if you're not going far, then you're not getting the deep knee flexion, you know.
yeah, and like that in itself could be an offloading strategy for the knee. Like you're just not exposing it to the more
Oh,
challenging positions.
for sure. I just did jump testing on a young guy who has a partial ACL the other day, and he was doing these very shallow jumps. And thinking into it, I'm like, oh, it's probably because he doesn't trust his knee and he is just, keeping it super shallow to not expose himself to that deep knee flexion, especially since he has a history of a rectus femoris avulsion fracture on that same
Yeah.
knee. So that quad
Jeez.
is that quad is getting it hit top and bottom.
Yeah. Jeez.
Yeah. But did that clear up any questions around like plan, Mike, like how you would implement this? Do you have any other thoughts around implementation or how to utilize this? Excuse me. Nope. You back?
How long was my mic muted? I'm like, come on.
You're gone for like 10 seconds. You're fine.
Okay. So I was saying like plan like exercise prescription wise, like you're doing some deep knee flexion isometrics to get used to that position, and then you're also implementing other like just jump tests or like the jump tests as an exercise too, but then also like uh step down, like quick step downs, quick snap downs sort of things
Y-
to
y-
get used to the eccentric component.
Yeah, because like your concentric is only going to be as good as your eccentric. So build the comfort in those deep knee flexion positions and then just build the resilience and the capabilities to eccentrically load into those under quick fashions.
Cool. And are those single leg too, or are those double leg?
I would want to bias that right side as best as I can within symptoms. Um, if she can do single leg variants and have no pain right away, I'm gonna do that because then that takes away any chance of offloading through training. But you have to take every patient individually, and if they can only get into those deep flexion angles through like a kickstand or like a partial, then you might just have to do that. But while you're still exposing them to the deeper angles with exercises such as like isometrics and stuff, and hope that like you can cross that bridge over time.
Cool. Yeah, that sounds good. I don't think I have any other questions.
Sick. Cool. Yeah, no, I think that was great. I think that was good chat.
Yeah. So cool. This has been another episode of Data Nerds.
Data
As always, if you enjoy what you're listening to or watching, please leave nice ratings on Spotify or Apple Podcasts, or if you're on YouTube, like and subscribe. Thanks.